My name's Nick. I graduated from the Bachelor of Oral Health in 2010 and I've been working in the public sector ever since. Having had a chance to look back at the research topics that we did, I sort of realised that there was sort of a two-pronged approach to the way that it was structured. Obviously, for a research assignment, you want it to be able to focus on the dental curriculum and to learn the dental theory. But on the other hand, there was also a very obvious push towards encouraging independent research. One of the key purposes of the assignment was that we would go out and we would find our own information, we'd do our own research beyond the recommended text and beyond the lectures. You need to be able to assess the information that's out there. You need to assess if it's relevant enough to include within the assignment.
Hi, I'm Chantel Nowicki. I'm an oral health therapist and I've been working for 3.5 years and I work at Smarts Russ. There was a big difference from first year to third year. First year was a bit of a rude shock. Going from year 12, we were already doing some research sort of assignments and things, but I guess the level of intensity was a little bit more for first year. Having it in a group environment made it a little bit easier for workload, but also to help each other out in our own research as well, and that kind of carried through all the way through to third year. In third year, we heavily used our facilitator for our assignment to direct us and guide us in the right way for researching our topic. I guess she helped us tailor our assignment so that we could still encompass it, but broaden sort of the topic so we could get more information on what we needed. And even now, outside of the university, we still bounce off each other at work and with specialists too. Pretty easy to contact them. So if we're ever sort of stuck for ideas or don't understand content of things, we can still bounce off people that might have a little bit more of an understanding. So that's been really great.
It's a baptism of fire in some ways. It's great to look back after having done the assignment and realise that you have the ability to do that. And when it comes to a university curriculum, the sooner you learn how to research independently, the more valuable those skills are and the better you can hone those skills throughout your academic career. I feel that once you graduate, you're basically a qualified professional, and as a professional there are expectations of you, and that it's up to you and no one else that you continue to be at the head of knowledge in your field. If at any point a patient is to quiz you or to ask you why you're doing the things you're doing, you can quite confidently give a very frank explanation as to why and feel that you're doing what's best for the patient.
For me, one of my main priorities is patient care. So I want to make sure that my patients are receiving the best that I can provide with the knowledge that I have. So I think if I didn't have that sort of research background, I wouldn't be able to provide as good care that I can now. You're not always going to have someone to constantly turn to and ask questions, so it's important that you know how to research yourself so that you can find the answers that you need for yourself.